Hello, I'm Dr. Mark Gottlieb from Danville Materials, here to demonstrate the use of Danville Materials' innovative new product, the ABC Wedge. You may know Danville Materials for the original Prep Start Air, or for being the world's leader in air abrasion technology, or for the complete family of flowable composite materials. At Danville, it's all about innovation and bringing you the best products inspired by dentists for dentists. The ABC Wedge is the solution for a common problem. When attempting to restore a very large Class II lesion, or a tooth with a fractured cusp, the traditional separating rings will crush the matrix band into the preparation. On the left is a clinical photograph of the problem. The solution is shown on the right utilizing a pair of left ABC wedges. The original dental wedge was designed to be placed between the teeth to prevent excess amalgam from being pushed beyond the gingival finish line and preventing an overhang. This patient presents with the chief complaint of chronic bleeding around the bicuspid. The bleeding is clearly the result of the poor adaptation of the filling material against the tooth. Almost every patient today desires white-colored, anatomic, and aesthetic fillings. The challenge when working with posterior composites is to obtain a tight, flossable contact. This tooth was pre-wedged to start the separating process, and then 4 ABC wedges utilized to support the matrix band and maintain separation with the Danville Mega Rings. Now let me show you how to apply this to everyday dentistry. This patient presented with a failed fractured amalgam in tooth number 30, the lower right first molar. The radiograph confirmed recurrent decay directly under the fracture, and the patient requested a white, tooth-colored filling. Once the old filling was removed, there was a moderately large box that needed to be filled, and that utilizing a separating ring would be difficult, if not impossible. If placed directly over a conventional wedge, the matrix band would get crushed into the box. Since there is a rubber dam in place, the ABC wedge will need to be modified to clear the clamp. I'll also trim the embrasure area of the wedge to broaden the contact. The ABC wedges were placed on the buccal and the lingual, sealing off the gingival floor. The separating ring is then seated along the grooves on the back of the wedges. This not only centers the pressure in approximately, but also secures the ring, and they are less likely to pop out of the mouth. The tooth is then incrementally filled with composite. Here is another challenging case. This older patient fractured tooth number 21, the lower left first bicuspid. This tooth has significant buccal recession and a small, thin mesial contact area. All the separating rings will ride up the cingulum area of the left bicuspid. An extra small left ABC wedge was placed between the teeth, creating a parallel wall, allowing placement of the separating ring. Once in a while, the patient really needs a crown but cannot afford one. It's always worth a try to build up the tooth in composite and buy them some time until their financial situation changes. Here is an example of a financially strapped patient who decided to restore the bicuspid with composite utilizing 4 ABC wedges and a full matrix band. Utilizing Danville's ABC wedge system allows you to think differently. Here's a clinical situation where the patient is constantly getting food stuck between the molar and bicuspid. Traditional dentistry would be to restore the tooth with a crown, but now we can use a posterior composite and restore this tooth back to form and function, maintaining a tight, flossable contact. The ABC wedge can be used with any of the currently available separating ring systems. As you can see, placing the ABC wedge in approximately before seating the ring prevents the ring from crushing the matrix band into the preparation. The ABC wedge is currently available in 4 sizes, curved to the left to the right. Each package contains 24 identical wedges, and the suggested retail price is around 20 cents. If you would like additional information, please contact your local dental dealer or call Danville Materials at 1-800-827-7940.